window to reopen, but only after meeting the requisite standards of hygiene and safety. On the requirement of mass testing of eateries and restaurant workers, this is a necessary intervention to break the cycle, to limit the possibility of transmission within such establishments. On this matter, we are working on a plan to have all food handlers tested. This is in the face of challenges regarding some of the essential components for testing. We call for patience and cooperation of the management of these facilities. We encourage those facilities that can arrange for private testing of their staff to do so in consultation with the Ministry of Health. A detailed protocol on these guidelines will be posted on the Ministry of Health website and will be shared through public media in due course. Restaurant management must read and understand these guidelines, as the reopening is predicated on full compliance to the guidelines. When I finish, Dr. Kuria, who's on my right here and who is our acting director for the Directorate of Public Health, will talk some more on these protocols and guidelines. Fellow Kenyans, regarding our COVID-19 situation, I'm glad to note that today we have discharged a total of 10 patients. This brings to 124 the total number of recoveries, which is very encouraging indeed. I want to take this opportunity once again to sincerely thank our healthcare workers and all those who have contributed to these achievements. I also want to assure Kenyans that COVID-19 disease is treatable. With proper management and care, patients have healed and reintegrated back to society. Therefore, there is no need for us to stigmatize this disease. As we celebrate the recoveries, let me remind Kenyans that this is not the time to celebrate and lose sight of the ball. The enemy is still in our midst. It is therefore absolutely necessary that we continue to strictly observe the containment measures that have consistently been advocated for by the Ministry of Health. This is the only effective way of containing the spread of infections. And this has been proven in many of the countries that are mounting a response to this COVID-19 disease. Fellow Kenyans, on our latest COVID-19 situation, I want to report that we have 11 new cases out of 589 samples tested in the last 24 hours. Our total number of COVID-19 positive cases now stand at 374. In today's cases, there are 2 children aged 3 years, and the oldest is 75 years. Out of the 11 cases, 7 are from Nairobi and 4 from Mombasa. Of the 7 Nairobi cases, 4 cases are from Kawangware and 1 from Isli, Manji Estate, and Kaloleni. All the 4 Mombasa cases are from Kibokoni, that is the old town. We therefore want to request residents of these areas to take extra measures to avoid contracting the virus. It is important to note that the trend of positive cases in the last few days has been restricted to Nairobi and Mombasa. This is indicative of increased local transmission in these 2 counties. We have therefore enhanced contact tracing, surveillance, and infection control management in these counties. The rest of the counties are strongly advised to continue observing the containment measures. I also want to take this opportunity to encourage our security forces to continue the good job of ensuring that people do not leave and get into these counties with restricted movements. And to the rest of the country and the inhabitants of these counties, I continue to plead for your patience, cooperation, and understanding. Together we shall beat this virus and resume our jobs, schools, businesses, and social interaction. We can, once we have beaten it, revive our economy. Cumulatively, the age group of 30 to 59 continue to carry the burden of this disease in our population. They account for 224 cases, roughly 60% of the 374 total cases registered to date. When you add to these the 99 cases in the age group of 15 to 29, we have a figure of 323 cases from our most active segment, that is between 15 to 59 years. We therefore encourage these groups to rededicate their energies in observing the containment effort. I will read out to you now the distribution of cases by county. Homa Bay has one confirmed case, Kajiado 3, Kakamega 1, Kiambu 5, Kilifi 9, Kitui 2, Kwale 1, Mandera 8, Mombasa 97, Nairobi 241, and between Nairobi and Mombasa cases, they account for 90% of our cases. Nakuru 2, Siaya 2, Uasin Gishu 1, and Kwale 1. That brings it to the 374 confirmed cases that we are reporting as of today. Thank you, and allow me now to request Dr. Kuria to step up to the podium and talk on the guidelines and protocols for food, eateries and restaurants.
Thank you, CS, members of the Fourth Estate. As the CS has rightly put it, yesterday there was an announcement that restaurants and eateries may be reopening. And indeed, from the social media, you learned that indeed some did open restaurants and eateries, and some even opened pubs. Some may have seen these guidelines from elsewhere, and some have asked questions as to how they are going to be implemented. Let's put it as the Ministry of Health that the guidelines will be rolled out through the MOH website in the next few minutes. The guidelines, and as to why the CS pointed out that those restaurants are not opened, was to provide structured way of reopening these restaurants and eateries so that all the measures that the ministry had put in place to contain COVID-19 can be maintained, while at the same time allowing some opening for business to run. The guidelines therefore provide a way, the structured way, that the restaurants and eateries are going to reopen these restaurants and eateries. So as the CS has said here, they are not open, and they shall only be open when you fulfill the guidelines provided in this protocol. The guidelines are not very punitive. They only reinforcing the social distancing measures and hygiene measures that have always been advocated by the ministry. And they are not new requirements. What we are saying is that those restaurants and eateries that have been operating, they had health approvals. And they knew, every hotel operator or restaurant operator knew that you had to apply for a permit to operate a restaurant or eatery through the county public health department. So these guidelines or protocols are there to reinforce the extra hygiene measures that will be taken during this COVID-19 pandemic. And they basically talk about the same distance that have been told to maintain of 1.5 meters between one person and the other, the use of face masks, the need for continued screening, and the need to sanitize at all times. And all the prerequisites simply state that you'll be allowed to operate your restaurant between 5 a.m. and 4 p.m. Kenyan time until further notice. And this is upon reading and implementing the provisions of this protocol. As I said, these protocols will be accessible from the ministry website, www.health.go.ke. Eateries and restaurants then will be required to install hard wash facilities, complete with hot and running cold water, hygienically operated taps, detergent soap, sanitizer, and operate hard drying at the entry of their kitchens. Restaurants can reopen safely during the coronavirus pandemic by limiting diners to at least 4 people per every 10 square meters of space. There may be challenges here in some restaurants or some eateries that don't have this kind of space, and they would have to put in arrangements by limiting the number of customers that enter your premises, because we cannot risk losing all the gains you have made by trying to open restaurants and you cannot obey the social distancing measures that we had put in place. Then for those who have dining facilities in their restaurants, the tables in the dining areas must be spaced 1.5 meters apart, and the seat customer groups at least 1.5 meters apart. For those who had booked events or banquets, we have encouraged them during this pandemic to postpone or cancel those events altogether if you are going to host more than 15 attendees. And between the tables, the distance back to back from one chair to the next one should not be less than 1 meter. And those guests that face each other from a distance of at least 1 meter. If events and banquets are held at the facility for smaller groups, you work with event organizers to ensure that individuals who are sick with coronavirus symptoms do not attend those events, and that those attendees in those banquets are spaced at least 6 feet apart. And we are to temporarily discontinue self-service, and we encourage ready-to-eat foods as much as possible. As for food service, again, we are discouraging self-service, and customers shall have their meals served or delivered individually to the dining table by appointed restaurant stewards. There are other measures, of course, concerning the food handlers, the medical screening for the food handlers, and more importantly, is that for all those restaurants and eateries, they will be required to install a contact-free thermometer and ensure that every person entering the premises has his or her body temperature taken. Anybody coming at a temperature of above 37.5 should not be allowed to enter those restaurants and eateries. And then all restaurants and eateries must provide a hand washing station with clean water and soap at the main entrance to the premises. And the effluent water from those eateries, some have been seen to be running off into the streets, are to be discouraged, and they must all drain into an existing sewerage system. And then all restaurants are required to provide 70% alcohol-based sanitizers at entrances and other areas where there are shared surfaces, such as dining tables and counters. For the hotel workers, any staff member, as I said earlier, or a reveller with a temperature above 37.5 degrees Celsius shall not be allowed entry into the premises, and the premises shall immediately notify the Ministry of Health through their toll-free number 719 for guidance. And most importantly, all food workers deployed to work in those restaurants must be tested and certified to be COVID-19 negative by a government-certified laboratory. The measure here is we do not want anyone who is COVID positive working in a restaurant and posing any risk either to his fellow workers or to those customers entering those premises. There is a detailed guidelines as to how you'll be required to open your restaurant. So as the CS has said, you're not supposed to open until your premises have been inspected. On the website, you will find guidelines on how you are going to apply for a new permit. And the guidelines foremost is that you must show at least that you read and understand the protocols well, and then implement all the provisions that we have read out, that you read in the guidelines and the protocol for managing those restaurants and eateries. Then some may require that you develop SOPs that you are going to follow some of the protocols highlighted here. Then you have to submit an application using Form A, which is again on the website, for a permit to operate food business, and submit this to the county public health officer dealing with food safety. And then once you download and fill in your form, present to the county public health officer, then you'll be required to open your premises for official inspection. There is a form we have provided to all county public health officers that they will go through, and there's a checklist that we'll be going through to make sure that you comply with all those requirements. Once again, I point out here, the requirements are to ensure that all the gains you have made in containing this pandemic are not lost by opening these restaurants. And we urge a lot of patience for the operators. As they get inspected, please be patient and do not open until you are fully inspected and licensed. And then you must provide evidence that all the workers in that facility have gone through medical screening and have tested negative for COVID-19 at a laboratory designated by the government. The CS has pointed out here, those large establishments may seek this testing from private facilities. This, bearing in mind the current constraints we have in supply chain of testing kits and sampling kits, those who may wish to visit private facilities are encouraged to do so. Word of caution here is that there could be others out there who say they are going to offer this testing using rapid tests. You said you must do this in consultation with the Ministry of Health, because those rapid tests are still not yet approved by the Ministry of Health. Then you only commence operations, and we repeat here, you only commence operations of those premises upon receipt of a permit from the county director, the public health to operate food business during the period of COVID-19 pandemic. I'll stop at that, and thank you very much.